It's time for your healthy dose of information, keeping you healthy from Hannibal Regional Medical Group and Hannibal Regional Hospital. And joining us this morning is Linda Dingus. And Linda, what is your title there at the hospital?
Good morning, Greg. I'm director of Chris Coons Women's Care Center at the hospital.
Okay, great. And the Women's Care Center doing some great things there. We were talking about breastfeeding today, right?
Yes, we are.
And what an awesome topic. It's something that I know I'm a guy, but I mean, I've got six kids, and it's such an important thing that, you and I were talking about it, that people get over it. It's something that is a great thing for mom. It's a great thing for baby. It's a great thing for their bonding and for the health of the baby. And you've got information of how workplaces are making it even better for the mom to be able to pump and to be able to make sure that things are taken care of as she returns to work.
That's definitely what we're going to talk about. In 2010, there was a Patient Protection and Affordable Care Act that actually stated that employers are required to give breastfeeding mothers a place to actually pump their breast milk during the work time. And we received an award called the Breastfeeding Friendly Worksite Program Award. We received a gold level in April, and that is a site that it says you have been cited for having exceptional places for women to breastfeed and pump during their work time. We also have 3 areas of lactation rooms. We have one over in the Children's Center, and we also have one at first floor across from the Women's Care Center, and then we have one on second floor. And the hospital being a baby-friendly hospital and really supporting mothers in breastfeeding, we can have as many as 10 to 12 mothers that actually are working at Hannibal Regional Hospital and breastfeeding their babies and pumping during their break time so that their babies will have enough milk.
That's awesome. You talk about pumping, which you can actually put in the fridge or freeze it for quite an amount of time, right?
That's right. Usually in the refrigerator, breast milk is good for 48 hours. But if you put it in the freezer, it can be in a regular freezer for about 3 months, and it can be in a deep freeze for 6 to 12 months, knowing that the temperature stays even and it's not unthawed. It stays frozen the whole time. So mothers, in the 12 weeks that they are usually given before they go back to work, they can have a stash that they have in their freezer ready, or they can actually pump the day before so that the sitter can take care of their feeding needs for their infant for the next day.
Yeah, or if dad's at home with the baby and
yes, or any family members that would be caring for the baby.
Definitely. And, it's a situation with my wife where her dad used to bring the baby by where she worked for her so that she could actually feed the baby there at work, and they'd get that little time together. But employers need to be aware of this and offer not only the area for this to happen, but also the time.
The time and the support. There's a cost savings of $3 per every dollar that they invest in a breastfeeding mother that is working in the workplace. She is feeling satisfied because she is caring for her infant even when she's at the workplace. And the biggest benefit that they see is that it's the health of the child. The breast milk is full of live antibodies, and so that stimulates the immune system, and the baby's actually going to be healthier. So mother will actually lose less time at work because she is providing for the wellness of her infant.
Do you think how big is the issue, you think, just across the board of workplaces not being friendly toward mothers who are expecting, or maybe mothers that need to be breastfeeding at a time? I mean, do you think it's at a point where it's more mother friendly, or do you think that a lot of places could be a lot better about it?
Well, I really believe that the education of the employer and the mother coming into her workplace and talking to them beforehand. You just don't show up at work 12 weeks after you have a baby and say, I need this. Mm-hmm. So this is what this program is doing. It's actually setting guidelines for support. And in Missouri, there's about 100 different baby-friendly, breastfeeding-friendly worksite programs. Mm-hmm. So they're becoming very knowledgeable. But we have support groups twice a week at the hospital, and we also have breastfeeding classes before mothers deliver their babies, so that we can teach a mother how to really approach your worker and your employer about what it takes to help support me in breastfeeding my child. So there really is a responsibility for both the employer and the mother. I watched a program about things similar to this about a week ago, and it is an issue that a lot of people, you don't think about it, and especially if you're a male in the workplace, you've never had kids, you never went through it, you don't realize that they don't really know
how it works, you know,
Sure.
and the intangibles that go into it. So it is very important, I think, to get this out, and like you said, go to them beforehand, right?
Right, and the one thing, as a director of a unit that has babies, we go around and talk to the mothers in the room before they go home and say, are you planning to continue to breastfeed when you go back to work? So we also have lactation consultants, Diane Bibb and Marla Whelan, who have a 24-hour warm line to help mothers with that, but they also encourage them to come back for that support group,
Right.
which is every Monday night at 5 o'clock and every Wednesday at 10 o'clock. And we can have as many as 18 mothers and their babies come back for that support group, so that the support for the mothers that are breastfeeding, even from each other, and they help each other with what they do, especially in the teaching area. I think teachers have partners where if there's 2 or 3 breastfeeding moms, then they will watch the other classes so that
Right.
they can go pump and do the things they need to do.
Linda, it's all about the support, isn't it? Because when the lactation consultants initially come in and talk to the new mom, it's so important at that time that the mom learns how to breastfeed, and that it's done without pain, that it's done properly for her, for the baby, because it can be a very rough, bad experience if you don't do it right, and they come in to help that process right off the bat. When you're in these support groups with other women that are going through the same things, that's a huge help. And then women have been in the mindset for so long that when you return to work, you got to go to the bottle, you got to go to the formula, and that's not necessarily the case, is it?
No, it isn't. And the one thing that we find is when a woman is confident within that first month of breastfeeding, and that's when she needs the help. It's a beautiful thing to breastfeed a baby, but while you're struggling, you may not have enough milk if your baby doesn't latch on. Those are the things that we've really worked on at Hannibal Regional Hospital, with being a baby-friendly hospital since 2009, which is actually an organization that looks at hospitals, teaching and support for mothers later, what we do at the bedside, and since we have become baby-friendly, we recognize that it's in that first month the mother needs the most support. So we do callbacks. We also encourage them to come in and weigh their baby frequently so that they know that their baby's gaining weight. And we work with the pediatricians, and we also work with Hannibal Clinic, who is also a breast-friendly worksite place.
That's awesome. Even for moms who may have tried it with a previous birth, and now they're coming back and saying, I couldn't do that, it didn't work out, and you're still giving it another try and watching it be successful, right?
Well, the evidence shows us that a mother that breastfeeds for a small amount of time, even in the beginning, the second time she increases her amount of milk, and she increases her confidence. We all know that first baby that you take home, even as an OB nurse for 35 years, there's fears about, do I know what exactly that baby needs? So as we become more confident, as you breastfeed more babies, it becomes much easier.
Yeah. If people want information, if women want information about your great women's care center there, or they want to know about breastfeeding, what do they do?
They can get on the Hannibal website, the Hannibal Regional Hospital website. They can also call us at 573-248-5161. That is directly to the hospital Women's Care Center. Or they can actually call the warm line for breastfeeding, which is 573-406-2122, and talk to Diane Bibb. She's a lactation consultant that is available 24 hours a day for any questions.
Okay, Linda, anything else?
No, I think we're glad to be here and very happy to be able to spread the word about mothers that can go back to work and breastfeed successfully.
Yeah, that's a great thing. You had mentioned, too, it's a law now in the state of Missouri.
Yes, in March of 2010, this is a federal law, so it's a law in the United States, that the Patient Protection and Affordable Care Act says that all employers are required to provide a place for mothers to pump their breast milk for their babies at work.
All right. I know that we're even familiar with that incident here at the station at WGM, and it worked out great for the
wonderful.
mom, and everybody was so excited, and I think even got a little more chance to see the baby too, and that's a great thing. So
You bet, because
it's all
when
good stuff.
mothers and babies get to bond more, and working mothers really need that. And sometimes babies will nurse more often when mother has a day off, but that will increase her milk supply. So the child does know how to bring in more milk when they need it.
All right. Well, keep up the great job. I can tell you're very excited, very passionate about what you do.
I sure am.
That's
Thank you.
wonderful. It's Linda Dingus from Hannibal Regional Hospital, Hannibal Regional Medical Group, and that's your healthy dose of information this morning. And we're talking today about breastfeeding. Again, if you want more information, go to hrhonline.org. Linda, thanks.